take a roll call of the membership for the minute of the meeting, and I would ask that members confirm they are present when I call their name. Councillor Lynn. Councillor Lynn.
Yeah, present.
Trudy McClay.
Present, Willie.
Councillor Short.
I'm here.
Bailey Wright.
Present.
Anne Buchanan.
Present.
Donald McPherson.
Present.
Dan McCulloch.
Present, Willie, thank you.
Thank you. Vicky Irons.
Yes.
Thank you, Vicky. Dave Berry.
Present, Willie.
David Wilson.
Yes, present.
Peter Dickey. Neil Buckland is absent. James Cotton. Neil Mark. James Cotton is absent also. Raymond Marshall. Mark Raymond is absent. Jim McFarlane.
I'm here, Willie.
Thank you. And I received apologies from Eric Knox, and I believe that Michelle Murphy is attending as his substitute. Is Michelle Murphy present?
Present, yeah.
Thanks very much. Martin Sloan.
Present.
And I received apologies from Dr. Emma Fletcher. David Shaw. David Shaw. Okay, I'll mark them as absent also. Okay, that then takes you on to the agenda as submitted, and I've covered apologies so far.
Can I just say that I'm here, Willie? I don't know if you marked me absent before. I just had trouble. I've got to wait till people admit me into the meeting. I can't get in directly.
Yeah, thanks very much for that, Pat.
Okay, thanks.
Takes you on to the agenda, and I've covered apologies, and it takes you on to item 2, which is declarations of interest. It's we're not any members of any declarations to the content of the agenda as it stands. Okay, and there being no declarations, it takes you on to item 3, the position of Vice Chairperson appointment. This is simply to note that the NHS Board have appointed Pat Kilpatrick into the position of Vice Chairperson of the Dundee Integration Joint Board. This will be effective from 1st of April 2022, and this is for noting.
Yeah, just if I could come in there, I'm both pleased and sorry about this appointment at the same time. I think Pat will be a fantastic addition to the board, particularly in the role of Vice Chair. But I think she's got a tough job ahead of her to match the commitment that's been made by Trudy over the last few years. A lot of kind words have been said about you, a lot of meetings, but this is officially your last one, Trudy, and you'll be very much missed. Although I'm sure that we'll keep in contact after this, because you've already stated your willingness to be kept up to date with what's going on in Dundee and do whatever you can to help in the future. So very happy retirement, although I'm sure you'll be busy in that retirement. And as of the 1st of April, Pat, I'm really looking forward to working with you, although it might only be for a month that I'll be working with you. Who knows, depending on the local elections and what happens thereafter. So, yeah, happy and sad at the same time, which... Thanks for everything, Trudy. And I see that Vicky's hand is up.
Yes, Chair, if it's okay with you, I'd also like to take the opportunity to note formal thanks on behalf of not just the management team, but all of the staff and frontline teams which we have across the partnership. Even in Trudy's remarks prior to the meeting starting today, it's very clear that Trudy has invested a huge amount of her time in terms of supporting the work of the partnership, spent as much of her time as possible, even throughout the pandemic, in getting to know frontline staff. And that was evident from your comments just before we started today, Trudy. So you'll be very much missed by all the staff and all the management team. And I would like to wish you a really happy and hopefully successful retirement this time around.
Trudy?
Can I just come in and say you've all been an absolute joy to work with, and I'm very proud of every one of you and every one of the team, because you obviously have Dundee at your heart, as I do. I'm a Dundee lass and I'm very passionate about everybody getting a fair crack at the whip. So thanks very much for allowing me to work with you.
Yeah, thanks. Funny to think I wouldn't be seeing your wee face coming up on the screen anymore, but time to move on.
But we'll see you for coffee.
Oh yeah, yeah. So
Okay, thanks very much, Chair. And I think that Dr. James Cotton has now joined the meeting. Is James Cotton, are you present? Okay. Takes you on to item 4. It's the Dundee Integration Joint Board proposed budget. The report by the Chief Finance Officer.
yeah, I'll bring Dave in just a sec. Really pleased to see that you're presenting a balanced budget today, Dave. And I want to thank yourself and Christina in particular for all the hard work that has gone into getting us to this position. I don't think there are any surprises here because all members of the board have been kept up to date with the budget setting process. We've had 3 briefing sessions, which were really welcome by all members and certainly by myself. And I'm pleased that we're at the position that we're in today, which sees a no savings or cuts, as some people call them, no savings or cuts budget, and also sees further investment in services. And particularly of importance, I think, is that further investment in the workplace in the shape of the pay rises. The next pay rise on April the 1st to £10.50 an hour for social care staff is certainly a very welcome part of the budget. Although, as I think I've said before, we still have a way to go to make a career in health and social care as attractive as it ought to be in terms of financial reward at any rate. Because I think that the reward from a career in health and social care isn't just about money. So I will ask you to, if you don't mind, Dave, to talk us through the budget, and then we'll open it up to questions, if that's okay.
Yeah, certainly. Thanks for that, Ken. Morning, everybody. Yeah, as you say, I mean, this report should be a kind of culmination of the discussions we've had previously. So we've had 2 IJB kind of budget, kind of formal reports on sort of budget development, as well as the development sessions. I know kind of, so hopefully kind of what you see today isn't kind of too much of a surprise based on those discussions. So the proposed budget that we've kind of laid out to you today takes into consideration the range of cost pressures that we expect the delegated budget to face over the course of 22-23. And that can be as a result of some of the national policy decisions that have been made. So you kind of just reference one there in terms of the social care pay uplift element. So we're kind of implementing the national policy on that side of things. National agreements such as the national care home contract, which is kind of negotiated kind of separately, as well as a kind of whole range of sort of local investment decisions that we are seeking the IJB's support, so that the IJB can deliver on its strategic and commissioning plan, the kind of the objectives there, and the sort of kind of the range of kind of necessary service investments to provide the support for each of the services. And that includes proposals for our kind of third sector, third and independent sector, and the support that's offered to them as well. So in the report, we've kind of set out, we've confirmed the funding position from both our partner agencies. So Dundee City Council set its budget kind of last month, and as we'd kind of suggested at the kind of one of the previous one of the development sessions, that was a flat cash settlement, albeit the council did pass on the significant amount of additional Scottish Government funding as required through to the IJB. In terms of NHS Tayside, they don't set their budget until next month. However, we do have a strong indication of what that's going to look like, and again, there are certain sort of government imposed, if you like, kind of sort of parameters around what they can and cannot do around the delegated budget. So no, that while there are still a couple of figures to be confirmed within there, such as large hospital set aside and also the impact of hosted arrangements, we're not expecting that to be any significant impact on the bottom line for our budget. As I mentioned, there's quite a significant amount of Scottish Government investment. We've set out what's kind of gone through Dundee City Council in terms of the budget. It's the money that's kind of flown through the council to be included in the IJB's budget. That's just about £15 million, but there's also kind of money that's comes through the health health route as well, part of the sort of health settlement, that will take that investment to in excess of £17 million for health and social care services, and that's kind of in terms of new money, kind of additional money coming in to support our position. So that's given us, so while there's a number of sort of national requirements to use that money, it has given us a bit more flexibility this year than we have had, which is where it kind of takes us to that net position of, as you said at the start, Ken, not requiring to put any financial savings proposals in front of you today. We've also been helped for 22-23 by additional Scottish Government funding for COVID. Now that money will come through this financial year, but anything not spent gets carried forward in a ring-fenced reserve to carry forward into 22-23. And that really covers some of our expected costs that we thought we were going to have to try and find from within our own budget for 22-23. Some of these costs will kind of drop off over the course of 22-23, but other costs will remain. But we've kind of retained some budget flexibility to support that into 23-24 onwards. We're also going to have the position again at this financial year end of having some quite substantial reserves, which again gives us a bit more flexibility and comfort, if you like, in terms of some of the budget pressures that may occur during next financial year. So it gives us the ability to respond to that accordingly. Now again, the warning around that is, of course, is once it's gone, it's gone. So we need to make sure that we spend that money wisely. And as I noted in previous IJBs, we'll be kind of looking to bring forward some over the course of 2022-23, some investment proposals around how we use some of that reserve. So we're not needing to use any reserves to balance the budget at this stage, so that's the kind of basis on which we're going on for the rest of the year. One issue just to highlight in terms of the reserves, I'm kind of seeking approval from the IJB to ring fence some of our reserves to support the switch over from analogue to digital, in terms of the telephony and kind of the telecare sort of side of things. It'll mainly affect our community alarm service provision, but it is quite a significant investment that's required, over £800,000 to invest to kind of upgrade all the community alarm equipment in individuals' homes, as well as our own sort of control centre, so it's compatible with the switch over from 2024. So kind of seeking support to earmark that. And I suppose the other thing just to kind of note is, while we've balanced the books for 22-23, it doesn't mean to say that there are not any financial challenges ahead of us. And you know, I just think I'm repeating myself from kind of this time last year, where we thought kind of we were going to come out of COVID, and we've spent the last year continuing to be as challenged as ever around the COVID response. We need to kind of make sure that we have our transformation programmes all in place and progressing at pace, to allow us that flexibility in 23-24 onwards to meet some of the significant pressures. It is highly unlikely the Scottish Government are going to be in a position of being able to invest the sort of levels of 17 million, a further £17 million, for instance, in 23-24. So we know that there's going to be a range of pressures there that we'll need to meet. We will bring to your to the IJB in June more of a forward look in terms of a 5-year financial forecast. So we did something similar last year. Given the volatility of the economy at the moment and the sort of kind of range of price rises that are around, we'll kind of provide our best estimate at the time in terms of what that might look like over the coming years. But it's likely that's going to kind of again show the similar gaps that that was shared kind of in previous years that we'll need to kind of plan for and try and mitigate against as an IJB in future. So I'm pleased to present a budget, as we said, with no ask for savings, but I'm happy to take any questions and comments on the report.
Thanks very much for that, Dave. One thing stood out there was what you said about the investment in digital telecare. This is something that I've understood more through articles I've read. I think it was in the national press over the last few days. I think there might be some alarm amongst, no pun intended, amongst older people because of this switch, and it means that instead of your landline just being plugged into the socket in the wall, effectively all telephone calls will be over broadband or voice over internet protocol. So I'm sure that we'll approve that investment. I'm certainly in favour, and I think we have a role in reassuring users of the community alarms over the next few years that we've got this in hand, that they won't be left without a service. So I will take the questions in the order that the hands were raised, and the first one is from Bailey Wright.
Ken, thank you. It's a question, but I'll be seeking assurances as well, because this is quite a shock for us to get what is really a standstill, no-cut budget. We're not used to this, and I do welcome it, but I also welcome the additional 40 social care staff and the investment into the rapid response team, which will try to reduce unmet need. And of course, the frailty of the population during the COVID pandemic will help to reduce delayed discharge. I also welcome the investment in supporting adult social care and the support for fair work principles, because that is quite important. I welcome the investment in health professionals, as the report is saying, support workers, social workers, mental health, and obviously the Mental Health Community Wellbeing Centre. And I'm fairly aware, because of the staff shortages, they will have to be addressed as we return to some sort of normal service. I think you rightly said we should be proud of our officers and our staff for keeping Dundee citizens safe during COVID. They've gone beyond the call of duty, ensuring vulnerable people get the services that they need, often putting themselves at risk as they do so. I think today we saw Dundee Voluntary and Voluntary Action has launched its strategic plan for 22-25, meeting the challenges. And I think we have to welcome that, because that's been one of our concerns. But really, what I'm asking is, obviously the IJB must rebuild the services that we lost during the last 2 years. And can I have the assurances that all the ring fence money for different projects will be fully spent on retaining and improving services for our vulnerable and those most in need in the city? And I think that's what we've tried to do all along. But I don't have an amendment, but I'm seeking assurances that that money is going to be spent and put to good use for people.
Certainly have that assurance from me, Helen. I don't know if you'd like to comment on that, David.
Yeah,
sorry, David.
Give me my Sunday name there, Ken. Thanks for that.
Yeah.
Yeah, I mean, the money is there. The money is available to be spent. We all know there are a kind of range of recruitment challenges that we're kind of working through to try and deliver on. But you know, that's probably the kind of biggest challenge is the ability to actually spend it. I don't know whether Vicky or Jerry want to kind of comment on that as well, but certainly from a finance perspective, know that funding is sitting there. It's not earmarked for anything else other than the proposals that we've set out there.
Jenny, did you want to comment?
Just to provide that assurance that as we remobilise, we are looking to probably not only get back the services that we have, but to take the opportunity to continue to improving services to try and target them towards more early intervention, prevention and things like that. So absolutely provide that assurance, Bailey, right?
Thank you, Jenny, for that, because I know if you've said it, that's what will happen. And thank you, Ken, as chair, for saying that as well. Obviously, filling posts specifically for social care workers, we really need to make these jobs more attractive so that we can recruit more staff and also retain staff. So I hope that's going to be a feature for the future, retaining staff and recruiting more. 40 is a lot to fill, so that's a big job. So thank you for that.
It is, and just to say, I hesitate to use our biggest priority, but certainly one of our biggest priorities is the recruitment, retention and the well-being of staff.
Yep, I agree. I think that's the biggest challenge we have, making sure that we can recruit the right people and treat them well when they're in the job and pay them appropriately, which, I mean, we're on that road, but I think there is obviously still a way to go. So thanks for your question, Helen. We'll move on to Trudy.
Well, Helen's almost stolen my thunder because I'm going on to my hobby horse of recruitment and attraction of staff. And I echo your comments, Ken, at the beginning of the meeting about careers in social care. And I was glad that you used the word career rather than job. Because those people who go into people's homes providing care do a fantastic job. And they are on low pay, and people think about it as a job. What I have always banged on about is we should start calling it a career, as you have done. And careers always have pathways that provide opportunity to develop into new roles. And I think there should be some focus on allowing or supporting those who care at home to try to develop into new roles that would advance their earning capacity, would advance their careers. So I'd like to see that as a huge opportunity for our staff who care at home. And can I just go on? I've got a couple of things. At 4.2.1, I recognise that there are going to be increases in prescribing expenditure over the coming year. But I'd also like to see more of a focus on realistic medicine. We've seen some successes in mental health in the men's group with the men's sheds. So instead of medicalising people, we're directing them to not everybody, but those who want to the men's sheds. And that has been hugely useful for people's mental ill health. And supporting that community is key. And I think we should really be thinking more about realistic medicine, giving people opportunity rather than medicalising to get healthy and fit. The other thing was I was extremely pleased to see the additional funding in the provision of adult social care demographic because of the demographic growth. And it's great that we're really thinking about reducing the stays in hospital for people by providing support for those with complex needs, because being in hospital can make you iller, and it's important we get people home. So that's all I'd like to say, but well done on keeping us within budget, Dave and Christine. Great.
Thanks very much for that, Trudy. I certainly agree with the comments you've made about medicalisation of mental health issues, because very often it's not the case that it's medication that's required. It's some kind of other input, and we provide that through the listening service, for example, which I know you've always promoted. And I think we need to make sure that there's as much support, as much non-medical support available for people with mental health issues as possible. Donald, you're up next. Sarah, can you actually, I don't know, I noticed that Sarah's hand is up. I don't know if she had something she wanted to add. Or is it just, do you want to, is it okay to bring you in after Donald, or do you want to come in at this
Absolutely,
point?
it's a separate item, Ken, thank you.
Okay, so you're up next, Donald.
Okay, thank you, Chair. Thanks also, I add my own thanks to Dave and to Christine. I think not only for bringing forward a balanced and carefully thought through budget, but also for taking us along with you along the journey. I think I've certainly found the development sessions that you've held for us over the last couple of months really useful and make it much easier to come to a decision today. So, you know, I think we should just all acknowledge how helpful that process is. I had 3 points or questions, I suppose. I mean, the first one, like you, Chair, I was drawn to the switch from analog to digital telephony, and I mean, I'm conscious that we've had support from Scottish Government on an awful lot of things over the course of the last 2 years. But this switchover is something that's certainly not, it's not within Dundee Health and Social Care Partnership's control. And I see the cost is around about £850,000. But the contribution from Scottish Government is £50,000, which felt like a rather small proportion. So I was just curious how that relatively small number was calculated, or whether there's something specific about our situation that means we're going to incur additional costs. So that was my question 1. Question 2 was something that's been touched on in the previous development sessions, was the issue around the cost around inpatient mental health. And I know that's been an ongoing discussion, and I just wonder if Dave could give us an update of where we are on that, and if there's any continuing uncertainty, how that might impact on the budget. And my third question is really just, again, Dave spoke about bringing forward investment opportunities and proposals to during the course of the coming year. And I was going to just press him a little, if I may, to give a commitment of when these might be brought forward, because I think it's the more you remain in your existing situation, the more cost you expend that could be used to make the investments that would provide a better service, along with providing cost savings. So the sooner the better from my point of view. And you know, if Dave can give a commitment, that would be helpful. So these were my 3 points. Thank you.
Okay, thanks for that, Donald. Thanks to you and others for your kind words over the efforts that we've made to kind of get to the budget. And I must say, it's not just me and Christine, there's a whole load of other people involved in the process. So I'd just like to kind of thank my team and also the managers as well for their support and getting us this stage 2. So thanks for that. In relation to you, I'll take your questions kind of hopefully one kind of in order. So in terms of the digital, so the analog to digital position, yeah, the 50,000 is not a huge amount of money considering the total cost. We're a bit surprised ourselves there's not kind of more sort of funding being released for this one. There's not anything, there's not a particular reason why Dundee is only getting 50, and in terms of, and the shortfall so high is a recurring theme across the country, and different partnerships are looking at different ways of trying to kind of trying to fund this now. Given so the suggestion that obviously we're putting forward is this is an extraordinary cost that we are going to have to kind of pick up if we're going to if we want to continue to have the sort of the range of services that we have, particularly around the sort of community alarm, which is obviously really valued. So there's different approaches people are looking at how to fund. I think this is the best way for us to do it. Others are looking at potentially increasing the charges for community alarm to kind of in effect recoup that money back. I don't think that's really appropriate. for us to do. We will continue to seek further funding from the Scottish Government on that, but I see Jenny's got her hand, but my understanding was that's as much as we were ever going to get from them in terms of this particular round of funding. But we'll continue to kind of push every avenue to get more in to reduce that burden. Jenny, do you want to come in on that?
Yeah, it's probably, and I think it's fairly obvious, but there is actually no real choice in that we just will not be able to provide that service unless we make the switch. It's not something that we can defer or put off or not do. If we want to continue to have that service, we have to do this.
Thanks, Jenny. So hope, Donna, that gives you.
Yeah, thanks. And just on that point, to be fair, I certainly wasn't advocating that we withdraw the service.
No, no, definitely not. So, just moving on to your second question around the inpatient mental health side of things. So we are still in dialogue with between the three IJBs and NHS Tayside around how we manage that position in 22-23 onwards. There are a number of proposals, including the use of the COVID funding, because some of the pressures in inpatient mental health are actually as a result of COVID as well. So we're looking at how we can jointly kind of work around that side of things. We're also kind of looking at the actual kind of treatment of the inpatient kind of mental health service. In terms of the delegated authority to the IJBs and the responsibility of NHS Tayside as well. So we're still not quite concluded there. However, just to give you the assurance that within this budget, we've actually built in what we think might be a kind of a reasonable contribution to make should we be in a position to do that. So in the sort of current pressures amount that we've put in, we've included a kind of an amount for a potential contribution should it be needed. If we're not needing that, then obviously it gives us a bit more budget flexibility for 22-23 as well. So you okay with that one? Okay, and your final question, just in terms of the investment proposals, I suppose my response to that would be we'll bring them. But what we're not going to do is kind of just produce like wait till everyone's ready and produce one big report to say, and this is what we want to spend the money on. Proposals will come to you as an IJB once they are ready. So there are a number of things that we are working on at the moment, which will enhance and support our services, but again are looking at time limited sort of investment there. And that will also extend to even things like sort of kind of project management capacity to kind of help us with some of these the transformation programs to come forward. And so that supporting infrastructure, which are we don't have a kind of a full we don't have the opportunity to kind of have the sort of kind of full range of support functions that we need, and we recognise the partner bodies are also struggling with that side of things. So project management is one that every time you get into the detail of how to take something forward, there's a who's going to do it sort of look around the table. So that's something that we want to kind of put forward. And sort of kind of proposals around sort of quality assurance and how we're going to improve service provision, for instance, will also come to you. But I'll not say no, you'll get them all in September or something like that. It'll be once the proposal's ready, we'll kind of put that to the IJB with a recommendation that they fund their release reserves to fund that.
Okay, thank you, Dave. I know it was a valiant attempt, but no, I think the point you make about project management skills. I mean, having them in place is sort of the bedrock for then making changes. So we'll look forward to just seeing that as soon as you can bring it forward. And thank you again.
Thanks, Donald.
Next up is Sarah Dickey, please.
Thank you very much, and thank you, Dave, for presenting the position. I echo Donald's comments in regard to the support offered to members through the development sessions leading up to today. My couple of questions for clarification, please, if I may. The first one is Might there be any considerations required in regard to the emerging Ukraine position in regard to the budget considerations? And secondly, a note on page 8 in regard to the directions from the Dundee City Council to the joint board, that the date the direction will be reviewed is June, and I was just curious as to why it might be as late as June in terms of the review, when most of the boards will have made decisions by the end of April. Thank you.
I know, Diane, did you want to come in on that as well? Yeah. No?
Thank you, Chair. I'm happy to take the question in relation to Ukraine.
Yeah.
Dave may want to come in behind me. So I've literally just come off a meeting which is looking at the Teesside response to Ukraine and any resettlement issues. The reality is at this stage we're still waiting on full details coming through. We know that depending on the scheme that people come in, so if people come in under the family scheme, then there is no additional resources to local authorities who will primarily be the source of funding, or to NHS boards in regards to that particular scheme. But if they come in under the community sponsorship scheme or the super sponsorship scheme, then there will be additional resources that will be provided to local authorities in the first instance in terms of about £10,500. What we need to do is get the details in regards to how that will then flow through to, for example, health and social care partnerships. But for example, things like GPs would just come through the normal kind of scheme of new patient kind of funding, Sarah. So that side of things should just be managed, because individuals coming into the country will be treated as having the right to be here. So they would just apply for all the other aspects of support that they would get. What we don't fully understand at this time is whether or not there will be implications for things like mental health services in terms of any trauma that people might experience, or any additional health needs that individuals may come either just as part of their natural kind of particular kind of physical issues or emotional issues, or as a result of anybody who may or may not have been injured. At this stage, we're still through COSLA, in particular in terms of local authority side of things, negotiating with the Scottish Government and UK governments to have a fuller understanding of the implications for that, Sarah. So I think the only other part that we would need to be aware of going forward would be the implication of things like fuel cost, poverty on populations in terms of any issues that we may have. And we're already watching that the cost of fuel doesn't, for example, outstrip staff remuneration in terms of things like travel costs, etc. So we will need to keep an eye on that, and that will impact not just in terms of our internal but potentially our commission services, and we would anticipate that the government would take a view around responding to that. So hopefully that answers some of the question. And I'm not aware of Dave having put extra money in for it, but he might have.
So, well, thanks for that. That's helpful. No, we haven't actually put anything else into the budget for that, primarily because of the reasons that Dan set out. There's still a wee bit of kind of work to do around that, and we know that in previous resettlements, if you like, so where it's been kind of the sort of Syrian refugees, etc., there has been additional funding has kind of flown with that in terms of sort of humanitarian protection sort of kind of funding that's come through. So so you know, we need to kind of work through the detail of kind of what the landscape Diane's describing. And saying that, I mean, we have built in for the first time in our budget a bit of a contingency allowance as well for any sort of unexpected costs coming through. So you know, that might be something that we might want to kind of look at if there's significant costs start to come through through our sort of services to respond to that level of demand.
Trudy, what do you want? Sorry.
Sorry, Trudy,
Sure, can I come in on the Ukraine thing?
Yeah, I think had you finished, Sarah? Was there anything else?
I've got a second question. I'll come
The
back
second
on.
question, but
Yeah.
I've got Trudy.
thank you.
Trudy, wants to go first.
Yeah, Trudy, you want to say something?
Yeah, I just wanted to say about the Ukraine thing. I'm the Equality and Diversity person for the NHS Teesside Health Board, And with that, within that role, I have a lot of contact with the translation services. So I've been talking to Leanne Neve, who's the lead for translation, and they're doing a test of change with a video online translation, instant translation for Ukrainian and Russian, because there are no translators for Ukrainian and Russian at the moment in the NHS Tayside team. So I've spoken to Greg Colgan, and he has linked Leanne with one of your people in health and social care. And I think they're going to work together so that there are translation services for things like, how do I join a GP practice, that kind of thing. So they're working together. So I think it's a great model of integration where we're all working together to get this in place. Thanks for letting me in with that.
Yeah, I suspected it was on that subject, and thanks for the work that you've done there, Trudy, that I wasn't previously aware of. It's essential that we have translation services in place, particularly when as you say, there are none at the moment for speakers of Ukrainian and Russian. Next up is sorry, Sarah, your second question. Yeah.
So I was going to say I've got a response back for Sarah's second question. So yeah, the direction, the reason the direction's been reviewed in June is because that's when we will consider the kind of final element of the budget, because if NHS Tayside aren't setting their budget till after our next IJB in April, our next opportunity to then kind of come back and confirm the large hospital set aside and the hosted services and any other adjustments to the budget as a result of that decision-making process. And we'll need to come back to the IJB, so there'll be a fresh sort of direction will then be issued on that basis from there. So it's more a sort of kind of governance step rather than anything else.
Thank you, Dave. That's helpful. Thanks.
Next up is Councillor Short. Who's on mute. Although I don't see the little mute symbol, but I can't hear you, Lynn.
I
can't hear. That's it.
Sorry, can you hear me?
Yes.
Yes, sorry. Every month I start nice and rosy thinking, right, got my money, got my budget. And then I get to the month and I've got my £20 that's on a bit of string from my dad. I know we're at the start of the process, so it's great that we've got this budget, but obviously it's really important that we stick to it, but also make sure that we don't have underspends. I think we went to a meeting the other day, and I believe that we have things like lack of making use of funding that's come in for rehab because other local authorities have made use of those rehab places and things. So I think it's really important that we're as aggressive as we should be when we're going for making sure that we spend that funding that we are put aside. And the other thing I did earlier in the week was I had a trip with members of the CCU, the Bella unit that's to go into the Hilltown area. And we visited some of the third sector partners that they're starting to engage with. I'm just still very, very nervous that we're not going to end up having to pocket some of that shortfall because the unit is based in our local authority area. Are we convinced that some of that, I think it's maybe 428,000, is actually going to come to us? Because obviously things like statutory services for a social worker, etc., will have to come into that unit, and who's paying, who's picking up the tab, please.
Would like to comment on that. CCU being community custody unit. I had to think for a minute there, Lynn.
Sorry,
Diane.
show me in minute acronyms.
Thank you, Councillor Short. Maybe I can respond in part to that, but not fully. Our intention is to try to bring a paper to the next IJB, and actually in conversation there's a suggestion that we might want to consider whether Police Scotland, Prison Scotland actually would come along to the meeting in terms of explanations. So I don't have the exact answers that you're seeking at this moment in time, but we hope to be able to provide some of that at the next IJB if we can get the right people there.
Dave?
Yeah, I know that Perth and Kinross IJB are kind of leading on this side of things in terms of the prisoner healthcare side, which is a kind of hosted service that they provide, and the indications I've had from them is that there's additional funding provided through that route to support the sort of healthcare, prison healthcare element. And at this stage, we're not anticipating there to be any sort of any further additional contribution from us on that side of things, but they will kind of continue to monitor that through the normal sort of kind of financial monitoring and service monitoring process. So I'm not expecting there to be a kind of spillover because it's on our patch, but we'll keep an eye on that as Perth and Kinross have indicated.
Yep, Helen, I'll bring you in.
I believe it's resource transfer from the Scottish Prison Service that will come our way to pay for that. That's what I believe will happen.
Thanks for that. Yeah, it's really important that we ensure that the appropriate healthcare is there for the women who will be users of this new community custody unit, which you, Helen, have been a great supporter of, because the most of the women, well, if not all the women in that community custody unit, will be from Dundee or the surrounding area, part of our community. You know, not from elsewhere. So, yeah, really important. Really important to provide them appropriate healthcare if they're not from Dundee. Sorry, Helen.
Ken, you're absolutely right. It's in my patch. It's in my ward, and to be quite honest, I can't wait for it to open. Because the building looks good, and the services that they have. I've been a prison visitor for Cortonville for 26 years, and to be quite honest, I spoke to Dundee prisoners, the women prisoners through there, and this will make a huge difference to them, where they'll be able to see their families and have closer contact, and their families will be able to afford to go to see the women, their mums, and also in the past they've had to travel to Bridge of Allen, Stirling, to see their families, and some women never got visits, not even one visit a month on occasions. So hopefully when this opens, it will make a big difference for Dundee families. And I think it'll cost less as well. It'll be cost effective.
Linda, but did you have any follow-up there?
Yeah, it was just to clarify that probably with Diane actually, that the advertisement has gone out for the social worker. I believe that was money that was to be sent down from the Scottish budget, and the last I'd heard it was waiting to be signed off because our community justice team were a bit reticent about advertising without having the colour of the money. So can you just clarify that we were in a position to advertise and are bringing in those social workers that will be based within Bella, please?
We are somewhat deviating from the business at hand here, and we have a paper coming next month, but if you could go ahead, Diane.
I'm happy to seek that clarification for you, Councillor Short, and come back to you on that.
Thank you.
Thank you. Pat Kilpatrick, you're up next.
It's just a very brief question for Dave, and it's really about the digital investment in digital. I mean, the Scottish Government document, what was it, Scotland's enabling, connecting and empower Scottish digital healthcare strategy. It's good, and it outlines a lot of the things that we can use it for. Is there an opportunity for us to put a business case forward, Dave, to promote to help deliver our digital strategy for the Health and Social Care Partnership, you know, as opposed to waiting for the government to hand us bits of money which are often inadequate and don't really relate to the strategy. And I'm thinking here about how we could, and I suppose it might interface with the large hospital set aside, in the sense of saying, if we were to invest X in digital, this is the impact it would make on the quality, not just the quality, but also a more cost-effective solution, because we could reach people quicker, we could monitor their health, we could track their conditions. If you've got end-stage heart failure, instead of being trailed in at clinics or whatever, we can do that at home. We can monitor it remotely. We can monitor type 2 diabetes remotely. We can pick up on asthma. We can pick up on respiratory, on COPD. All of these things would both improve the quality because we would pick things up quicker before patients deteriorate, but also you know, would save us going into hospital and having to be tested and all that, because the attached nursing staff and other healthcare professionals would pick it up quickly. I just wonder if is that something that we could put together as a business plan and say to them, if you give us X million, this is what we can deliver, as opposed to just waiting on them giving us wee bits of money that are not really, it's not really doing the business for us. It's just a question, and it might be something that Dave and I could discuss out with the meeting chair, but I just feel, see it with the Tayside digital strategy as well. I just think, you know, if you could demonstrate to people, this is what we can, you know, we can, it's a save to an invest to save almost proposal. Sorry, I'm talking a lot, but I just feel quite strongly about it. Thank you for giving me the opportunity, Chair.
No, you're certainly not talking too much. Do you want to comment on that, Dave?
Yes, certainly. So, so one of our kind of outstanding kind of strategies that we want to develop, which has been kind of put on hold for the last couple of years, is around our own digital strategy for the Health and Social Care Partnership. So we do have an IT board that kind of works across council and NHS and has members of the Health and Social Care Partnership within it, including operational services. So we have got you know, a couple of professionals in particular who do a lot of kind of work around the sort of telecare side of things, like Matthew Kendall, in particular from an AHP perspective, kind of has been having a kind of good look at a lot of the sort of opportunities around that. We've kind of worked alongside the NHS digital strategy people, so Louise McTaggart in particular. She's part of our IT board. Now the NHS strategy is out. I think that's now been agreed and published. We need to obviously make sure we're complementary to what's going to set in within that side of things. So it's something that we are looking to kind of progress. Whether that, you know, that's a good point around kind of then going to the Scottish Government with almost like a strategy to say, right, we'll need support to fund that. I think is a really helpful suggestion. There is, I mean, we do, you're right, we do get some pots of telecare funding. We have over kind of the years been given kind of bits and pieces, which has been mainly around sort of testing things out rather than you know, actual kind of full implementation of a kind of larger strategy. But I suppose if, you know, as you say, the Scottish Government's published its own sort of vision and strategy for the future, then, you know, that arguably should be backed up with further investment opportunities. So yeah, happy to kind of pick up with that with you separately on that part as well. But I'll put that on our next kind of IT board meeting as one of the agenda items to consider as alongside the strategy.
Thanks for that, Dave, and thanks for your suggestion there, Pat, which seems to have gone down well. It's gone down well with me too. Trudy, you're the last hand I can see.
Yeah, I'm taking the license because I'm leaving to speak as much as I can. I agree with Pat. I think you do need a really good project management team. I think there should be investment in that. And talking about what Pat's talking about with telemedicine and things like that, there are all sorts of things making hospital at home easier, like handheld ultrasound machines. Our advanced practice nurses could then beam the images to somebody who could say this patient has an aortic aneurysm, get them into hospital, or this is nothing, just keep them at home. So it's really the medicine of the future. And I think Dundee could lead on that. And I think it would be great if you went to government and said, we could be the site that would promote this. So I think it's a great thing. And my last point, just in case I don't get to speak again, is that I am so impressed with your impact assessments. You're the first group of people who have paid attention and who have really made an effort to think about how each of your decisions is going to impact on the population of Dundee. And I'd love to see that spread throughout all the other meetings I go to, because often I feel that the impact assessments are just a tick box and people don't pay attention, but Dundee IJB certainly do.
Thanks for that. Just comment my own on digital healthcare. It's not just about pressing a button in an emergency when you need help. There's so much more that can be delivered through digital healthcare. And I know that I think Dundee's probably better set up to provide that type of care digitally than a lot of other places. People will have noticed a lot of the pavement's been dug up. And that's because the fibre optic broadband has been installed all over the city, and we already have Virgin Media providing fibre optic connections as well. So we're well set up in terms of the infrastructure. So yeah, that's an interesting topic for us to be following over the next months and years, Pat. So thanks for bringing that up. Dave.
Yeah, thanks. Just kind of on Trudy's point about impact assessment, again, I'll kind of give the credit to others who kind of wrote this. So Catherine Sharp kind of wrote this one in particular, but also, as you know, Joyce Barclay continues to kind of be heavily involved in advising and supporting us in terms of our impact assessments. So just to give the credit to where it's due on that one.
Yeah, great stuff. So I think we're at the stage where we either accept the budget or tell Dave to go away and come back with another one next week or whenever. But I'm just pulling up the... So yeah, there are no more hands. So are we happy to accept the recommendations from 2.1 to 2.8, which effectively approves the budget and instructs the finance officer to do various other things that are mentioned? I won't read it all out because you have it in front of you. I see nodding heads. So yeah, that's this item is approved. Thanks very much.
Okay, thanks, Chair. Takes you on to item 5, which is the attendance list for meetings and integration joint board commencing 2022. This is simply for noting.
Thank you.
And lastly, the date of the next meeting, I can confirm the date is actually Wednesday, the 20th of April, not 25th of April, as indicated on the agenda. That's for noting.
Okay, well, that's us for today. If anyone, I don't think anyone, unless anyone else wants to say anything. But Trudy, you haven't seen the last of me, don't worry. So maybe you're not worried. You're hoping it is.
I'll send Vicky my, I think I have done my home email, because my NHS email will just implode on the 1st of April. So.
Thanks very much to everyone for your attendance and contributions today. And thanks again for all the hard work to get us to where we are. Bye for now.
Thanks. I know.
Yeah. Bye.
Thanks. Bye.